We've been fully operational since October of 2008, and our virtual intensive care services are an enhanced layer of monitoring for our critical care patients here at Eastern Maine Medical Center, as well as currently Sebastopol Valley Hospital and Inland Hospital. But we're in conversations with several other hospitals in our region to develop a partnership with them to provide real-time connection to experienced critical care physicians and critical care nurses so that patients in the region can get that expertise of care. And so we're hoping to be able to expand our services so that critically ill patients can stay at their home hospital as opposed to having to come to Eastern Maine for specialty services, that we can do it through an audio-visual communication and consultation, and that patients that need to come to us, our physicians will already know about those patients and more of an in-depth history prior to them hitting our doors. Double watch, absolutely. All of our nurses have at least 5 years of critical care experience. They spend 2 of their shifts here in the critical care connection and 1 of their shifts at the bedside, so they're not losing that clinical expertise that they have. They are a resource nurse for all the nurses at the bedside as well as the physicians at the bedside. The physician may be at the bedside busy trying to stabilize a patient and may need to know some information about that patient. Our nurses have real-time information at their fingertips because they have full disclosure of the patient record, and they can look up things for the physician and the nurse at the bedside while they're trying to stabilize the patient. It's really been a huge win. We've had a couple of circumstances where a patient comes, he or she is very ill. The nurse is trying to get that patient prepared for a procedure. Our nurse has been able to do some research on why that patient needs this procedure and actually do some education with the patient. So that alleviates their fear a little bit. They showcased us a little bit with the Davies Award just because of the implementation of the technology here. I think that people think, oh my gosh, Bangor, Maine, we're, in the middle of the woods, but really it's amazing what we have to offer here at Eastern Maine Medical Center.